Hello, this is Dr. Jazayeri. Everybody knows me as Dr. Jazz. I wanted to talk to you about patients who already have implants, breast implants, and they want to change them for whatever reason. Sometimes it's contracted. The breast has actually gone hard. The capsule around the implant has gone hard, or maybe the implant is leaking if it's a saline implant, and so there's asymmetry, or they want to go smaller or larger for whatever reason. Now, if the implants are saline and one implant is deflated, that's actually very good because I can use sizers on that breast and we can decide, what size she wants to go. It's irrelevant what the implant is on the other side because the patient is essentially presenting like a virgin breast, and so we can size her and go from there. If the patient has the implant card information, so when the surgery is done, there is a card, with the implant information. There are stickers that each implant comes with, and usually there's a sticker with the patient's name, date of birth, when it was done, and where. And so if the patient has that information, that helps me a lot because I can look at the implant, I know what size it is, I know the dimensions, and then we can kind of go from there. The problem starts when the patient does not have that information. And I've had so many patients, especially with saline implants, the saltwater implants that we fill with saline. The patient says, well, I'm 100% sure these are 300 cc implants. And they were filled to 300. And most of the time when we go in, the patient is incorrect. And I think the problem is I don't know. Let me show you, these are saline implants. If you can see, there is a minimum fill volume and there's a maximum fill volume. I don't know if it's focusing, but for example, this implant has a minimum fill volume of 290 cc. So the implant has to be filled to at least 290 cc, which is about 10 ounces. And then the maximum fill volume is 350 cc, which is about 12 ounces. The manufacturers, however, were always very conservative with their maximum fill volume. We have learned from experience that for a saline implant to feel as natural as possible, we need to fill them about 10% or overfill them 10% from the recommended fill volume. So for example, the maximum fill volume of this implant was 350 cc. So I want to fill it to around 390, okay? And that may have been done, but the patient remembers a 300 cc. So we're basically trying to size the patient based on her memory. And like I said, unfortunately, most of the time, the volume that the patient tells me by memory is inaccurate. So I always recommend, if the implants are intact, especially if they're saline implants, we can take saline implants out under local anesthesia. I've done a lot of them. That's not an issue. We take them out, and it gives me a lot of information. I know what was the manufacturer, what was what was the size of the implant. I kind of know how much it was filled to, and then we can go from there. We can go larger if I feel that it's safe for the patient, or smaller, depending on that. If there are silicone implants, then again, ideally it would be nice to take these implants out under general anesthesia, and then the patient can already have a date, a couple of weeks from that day, so they're not walking around without, any implants. But it gives me a lot of information. If the patient has upper pole asymmetry, so if the breasts are asymmetrical here, I know to order different implants, for example. It tells me if they need a lift, what kind of lift they need, if they want to go smaller especially, because when the implant is smaller, it's not filling up the skin as much. And again, a big implant does not cause a lift, but it fills the loose skin. So the patient may require a lift just to tighten the skin envelope a little bit better. But that's always been the challenge, convincing the patients to have the two surgeries. And then unfortunately, some of these patients, they have to, go under anesthesia, pay for the implants, all of this stuff. Obviously, we can give them a discount, but there would still be a surgeon's fee. So hopefully, if you do get that implant card nowadays, you have a cell phone, take a picture of it. On your cell phones, you can create new albums. So I create an album, for example, and I would name it Breast Implant Warranty Card. That way you don't have to look for it, right? So let's say 10 years from now you come, you don't have to go through 10 years worth of pictures. You just look at that album and you can find your information, and then you can back it up on the cloud. So there's really no excuse not to have this information, but it will help you a lot because you're going to need that information at some point. So please, 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 as soon as you get them, do what I told you. I'm trying to help you out. All right. If you have any questions or you need more information, we have a lot of information on our website, before and after photos, www.drjaz.com, drjaz.com. Thank you.